Hi, good evening, everyone, and thank you for joining us for tonight's Medicare webinar. My name is Selena with Valley Strong Credit Union, and I'm joined this evening by Paul Sheldon with Paul Sheldon Insurance and Benefits Planning. Before we begin, I'd like to cover one housekeeping item. Throughout the presentation, we plan to answer a few questions from the audience. To submit a question, please click on the Q&A button on the bottom of the screen. We will answer as many questions as we can live, and if you feel that your question has not been answered throughout the presentation, please fill out a survey after the webinar and supply your contact information. Someone will reach out to you directly to answer your questions. Some questions may be more appropriate to be discussed at an appointment. If this is the case, we will respond to you with Paul Sheldon's contact information and then dismiss your question. We have a lot of information to cover tonight, so I'm going to go ahead and turn my video off now so that we can focus on the presentation, and I will begin introducing our speaker. Our speaker tonight is Paul Sheldon. He resides in Bakersfield since 1957. He graduated from Cal State University, Bakersfield with a BA and teaching credential in Spanish. Paul holds postgraduate degree as a chartered financial consultant and a chartered life underwriter from the American College, Bryn Mawr, Pennsylvania. Paul began his insurance career at Walter Mortensen Insurance in Bakersfield in 1984 and started his own agency in 1986, which he continues to own and manage today. Paul's agency specializes in Medicare supplement plans, Part D drug plans, long-term care insurance, life insurance, and group health insurance plans. Paul is a past president of the Rotary Club of Bakersfield and a past board chairman of the Salvation Army of Bakersfield. His hobbies include playing the piano and bass guitar, and Paul is also certified an Okinawan 4th degree black belt. Paul is married to Nisi, his wife of 39 years, and is a father of 3 sons, Drew, Derek, and Taylor. Paul is blessed beyond measures by God and his wonderful family, and to have Christina Humes, Lynn Smith, Kelly Van Horn, and Neslie Williamson as his hardworking, indispensable assistants. Now, Paul will go ahead and start the presentation now.
Thank you very much for joining us this evening. We appreciate the time you're taking to learn about this dull subject of Medicare. We're going to try to make this as palatable as possible, not scintillating, but tolerable. And we're going to start right now. Before we start our presentation, I wanted to give just an abbreviated history about Medicare. A lot of people don't realize that Medicare is not a law unto itself, but rather an amendment to a law that was already existing, namely an amendment to the Social Security Act of 1935, which just provided retirement benefits. Then next came along a second part of an amendment to the Social Security Act, namely Social Security Disability. And last of all, the newer kid on the block, Medicare, which was passed in 1965 as an amendment to the Social Security Act of 1935. Now, speaking of Social Security, before we get going, I want to give you some brand new news. There's some redundancy for you, new news. And that is that it was just announced today by an advocacy group for senior citizens called the Senior Citizens League that the 2021 benefit increase for Social Security benefits tentatively, and it looks like this is going to happen, will be 1.6%. So those of you who are listening, you can feel fairly secure that you will receive a 1.6% benefit in your Social Security retirement benefits. Now, last year it was, I said 1.6, I meant 1.3, I'm sorry. For 2021, 1.3%. This year it is 1.6%. So it's going to go down just a little bit from 1.6 this year to 1.3%. And this is tentative, but it looks like this is going to happen. Now, what's interesting is the average benefit for Social Security increase since 2010 has been just about what it is prognosticated to be this upcoming year. And that is, since 2010, it has averaged 1.36%. So what is prognosticated for next year, 2021, is just about what it's averaged since 2010, the last 10 years. Okay, let's get started with our presentation. And the first thing we're going to do is look at the title here, and we've got to change Medicare, to change or not to change, considerations for the Medicare AEP. And this, by the way, is an educational presentation, and we are going to get going somehow or another. If somebody can direct me, I'm trying to get my screen to go down, and for some reason it's not doing it. Do we do a right arrow or left arrow or down or up? Anybody? Let's see here. How about if we just scroll down here? I'm sorry about this. This isn't the way this is supposed to work. Can anybody help me out here?
Did you try the arrow?
Oh, there we go. Okay, I don't know why it wasn't working before. Okay, so now let's look at this word change. Now, change can be a very good thing or a very bad thing. One thing that irks me to no end is when I hear these politicians say, we need change. Well, what in the world does that mean? That can mean bad or good, but they're never specific about that. Does that surprise us? I don't think so. So change can be like the act of swallowing. You can swallow something that is beneficial for you, and you can swallow something that is detrimental. Likewise, this upcoming time of the year, between October 15th and December 7th, you can do things that are very, very beneficial, and you can also do things that'll be detrimental. And so we are here tonight to explain to you the things that you need to consider, and we're going to move at a fairly fast clip. However, as long as the electronics work like they're supposed to, we are going to make this presentation, this workshop, available on a recorded basis, and you can find that at probably a week or two from now on Kern School's website under the workshop link, as well as the Valley Strong YouTube site as well. Okay, so we said that this upcoming period of time between October 15th and December 7th is known as the Medicare Open Enrollment Period. The technical name for it is the AEP, which stands for Annual Election Period. And we're not talking about the thing that's going to happen November 3rd, but we're talking about the period of time between October 15th and December 7th. And we're going to talk about 4 parts of Medicare: A, B, C, and D. So the act of swallowing, whoops, let me get back there just one second. Now I think I see how to do this. We said that the act of changing is similar to the act of swallowing. They can both be beneficial or detrimental to your health. Here we have some characters holding up some different letters of the alphabet that pertain to the 4 parts of Medicare: A, B, C, and D, and a lot of different combinations of them. So the first question we want to ask is, to which people does the Medicare Open Enrollment Period pertain? The answer is the Medicare Open Enrollment Period pertains to those primarily, I should have put that word in there, primarily to those who already have 1 or more parts of Medicare, as well as for those who newly qualify for Medicare during the Medicare Open Enrollment Period. What does that mean? That means that, let's say your birthday is November 7th. Well, that means that your Medicare eligibility date is November 1st, which happens to coincide with the Medicare Open Enrollment Period, which is between October 15th and December 7th. So it can not only pertain to those who already have Medicare, but those who are newly qualifying for Medicare can also have a qualification period for Medicare the first of the month in which they turn 65, unless, however, your birthday happens to be on the first of a month, and the federal government came up with this weird part of the law that says if your birthday happens to be on the first of the month, your Medicare effective date is the first of the month before that month. So if your birthday, for example, is on 65th birthday, that is on November 1st, your Medicare effective date will be October 1st. How's that for a little bit of confusion? All right, next slide. What is the meaning of each of the 4 parts of Medicare, A, B, C, and D? And you know what? I'm looking, this is a technical thing, but I'm looking at myself on the photo here, and I don't know if there's a way to reduce this because it seems to be covering up part of the language here on the script. So if somebody in the technical end of things, if it's possible to fix that, that would be great. If not, don't worry about it. I can still read it. So Part A, when you think of Part A, just think of coverage for when you are staying overnight someplace. So in other words, the word part is synonymous with coverage. So coverage under Part A has to do with when you are admitted as an inpatient. And that is not only in a hospital, but that can be a skilled nursing facility. It can be a rehabilitation hospital, like what used to be called Health South, right down the street from us here, is now called Encompass. That is an inpatient hospital rehabilitation facility. Also, hospice is another area covered under Part A. And also, as I say in this little section right here, home health care can also be covered under Part A as long as it's followed by 3 days of hospitalization or in a skilled nursing facility, and as long as home health care services begin within 14 days after you are discharged from the hospital or a nursing facility, a skilled nursing facility. Whoops, I'm going to get used to this yet. Just give me a couple seconds here. All right. So we talked about Part A. When you think of Part A, just think of staying overnight someplace. Part B, however, has to do with when you are not staying overnight. In other words, for outpatient stuff. Outpatient means any treatment or procedure or visit done and over with the same day. So what would those things be? Well, we have a list right here. Doctor's visits, diagnostic procedures, physical therapy, chiropractic. By the way, people say, Medicare covers chiropractic. Yep. Part B, outpatient, covers chiropractic as long as it is spinal manipulation, also known as spinal subluxation. In other words, you're not going to have coverage by Medicare for massage therapy and x-rays done in a chiropractor's office, but you will have for medically necessary spinal manipulation, that is spinal subluxation. Also, durable medical equipment, what is that? Anything hard. And there's some things that are not so hard that are also considered to be durable medical equipment. Well, the things that are hard that are considered to be durable medical equipment, wheelchairs, crutches, hospital beds, oxygen tanks, CPAP machines, CPAP supplies. But guess what? Catheters, test strips, those are durable. Yep, they're considered to be durable medical equipment too. So your diabetic supplies are covered under Medicare Part B and considered to be durable medical equipment. Also, your prosthetics, like your artificial limbs and eyes, certain orthotics for your feet. And by the way, orthotics for your feet are normally only covered if they are going to, for a diabetic, for example, if you have a complication in diabetes, then quite frequently orthotics will be covered, but not for the adjustment like your normal orthotics that you get from your podiatrist. Those are typically not covered unless you're a diabetic or unless you need like a certain type of shoe for due to diabetes, stuff like that. Urgent care, ambulance, ER, infused drugs like chemotherapy, any type of infusion or a drug that is injected in a clinic, like if they're giving you an injection in your eyes, that can be covered under Part B as well. Certain oral cancer medications, not all oral cancer, but certain oral cancer medications can be covered under Medicare Part B, and certain drugs injected in a clinic or doctor's office, which is what I just mentioned a little while ago. Let's stop right there and see if we have any questions so far. So what we're going to do is we're just going to take a couple questions after a few periods of slides, and we're going to save the bulk of the questions toward the end. So don't be disappointed if we're not able to answer your questions right off the bat. And please don't be shy about this. I'm here to answer any questions you have about Medicare. Do we have any?
Yes, we do, Paul. We have 3 questions. Let me go ahead and start with the first one. The first one is, are pre-existing conditions that have not been previously covered by insurance covered?
You know, I did not understand the last part of your first sentence. Are what covered by, say that one more time?
Are pre-existing conditions?
Okay. Are pre-existing conditions covered by Medicare? Is that the question?
Yes, that had not been covered previously by insurance.
Perfect question. Medicare, since it started in July of 1966, has never had pre-existing condition limitations. In other words, pre-existings are always covered immediately by not only Medicare, but your Medicare supplements as well as your Medicare Advantage plans as well. Now, there is one exception to that with Medicare supplements. If you have, from the time you qualify for Medicare, if you do not get a Medicare supplement within 6 months after your Medicare effective date. So let's say your Medicare effective date is November 1st. Well, 6 months from November, you have to get a Medicare supplement within 6 months from November 1st, in that example there, in order not to have a pre-existing condition clause. However, even if you do wait longer than 6 months and get a Medicare supplement, the pre-existing condition clause can be as short a period as 60 days. In other words, after waiting 60 days, you would have full coverage for that pre-existing condition. But again, that's only if you enroll in a Medicare supplement anytime after 6 months of qualifying for Medicare. In other words, as long as you get a Medicare supplement within 6 months of qualifying for Medicare, you don't have any pre-existing condition clause. Pre-existing conditions are covered immediately, and they're always covered immediately with all of the Medicare Advantage plans. You don't have the 6 month period of time within which you need to get your supplement. That same rule does not apply with Medicare Advantage plans. Regardless of when you enroll in a Medicare Advantage plan, there is never a pre-existing condition clause. Next question.
Okay, so we have a couple, well, actually we have a good amount that are asking in regards to the age. I have a couple people that are asking, if I turn 65 in July of 2021, when can I be able to sign up for Medicare, since open enrollment is from October to December of the prior year?
Okay, great question. So we're talking about, with that question, we're asking about two different things. For the vast majority of people, about 80 to 85% of all people, Medicare will start for you the first of your eligibility for Medicare. Now, you don't have to start Medicare on your eligibility date, but your initial eligibility date is the first of the month in which you turn 65. That's true for about 80 to 85% of all people. And you say, well, who are the other 15 to 20%? Those who are under 65 and due to being disabled under the definition of Social Security disability. Once a person who is rendered disabled by Social Security after getting disability benefits for 24 months, that person will automatically be covered by Medicare. So the other issue is the open enrollment period that we're talking about here, October 15th through December 7th, does not apply to somebody who has not yet turned 65. It only applies to somebody who is 65 or older and is already on Medicare, or to somebody who is under age 65 and on Medicare due to qualifying for Medicare due to his or her disabling condition. Okay, hope that makes sense. Next question.
Yes. Is the 2021 Social Security increase effective on January 1st, 2021?
That tentatively is the idea. Yes, if it's it always changes the first of the calendar year.
Okay.
Any other questions?
We'll answer one more and then we'll continue, and then we'll start circulating the rest of the questions on the next part.
Okay.
All right. The last question that we have for this break is, when is a good time to sign up for Part B while still working? Does it cost more if you
Great question. That is one of the best questions that well, and not that you other people weren't asking good questions, but that is a terrific question. This is one of the most misunderstood things. Here's the short answer. If you're working beyond age 65, and whether you do not have Medicare at all, and I don't want to get too much in the weeds with this, or if you just have Medicare Part A, but not yet Part B. So if you don't have Medicare at all, or you only have Medicare Part A, here's what you want to remember. You want to apply for Medicare Part B about a month and a half to 2 months before you retire. So if you're planning on retiring, let's say January 1st of 2021, in other words, just about what, 3.5 months away, then if we work backwards a month and a half to 2 months, if you're going to retire January 1st, that would mean sometime between November 1st and November 15th, you need to apply, if you don't have Medicare at all, for Medicare Parts A and B. Believe it or not, you can. It is perfectly lawful. By the way, I don't like to say the word legal, because if you say it real fast, you don't know whether you're saying L-E-G-A-L or I-L-L-E-G-A-L. Is that how you spell illegal? I think so. So it is perfectly lawful not to have Medicare Parts A or B if you are covered by a group plan. Now, is that the right thing to do? It depends on your situation. And that is why I always encourage people, because there's so much information here, and every person can have a different nuance that pertains to him or her. I would strongly encourage you to call a Medicare professional. We're not the only ones in town. Now, we'd love for you to call us, but you can call. I would always get a second opinion, even if you are talking with a friend around the water cooler. Don't let friends give you Medicare advice. Don't let family members give you Medicare advice. Even though part of what they're telling you could be absolutely true, there can be another part that could be devastating to you. And I've seen it happen so many times, especially with people who try to give you advice as to whether or not you should pick COBRA or get Part B at a certain time, stuff like that. So the general rule is about a month and a half to 2 months before retiring, you want to make sure that you have Medicare Parts A and B. So if you already have Part A, you want to apply to add Part B. And if you don't have Medicare Parts A or B, you're going to apply for Medicare Parts A and B. Okay, we ready to move along here?
Yes.
Okay, let's do it. All right, so we've got Part C of Medicare. Is it because I have this thing too close that that's being covered up? Nope, that's not it. I don't know why that is covering this up. Okay, so we have Part C of Medicare. We already talked about Parts A and B. Part A is coverage for all your inpatient care. Part B is all your coverage for your outpatient care. Part C is a funny part of Medicare, but you can see that guy who's being kicked in the not so gluteus maximus doesn't think this is funny, because what happens is if you have Medicare Part C, you do not have Medicare Parts A and B. And you say, wait a second, that's not true. I'm covered by Medicare. I'm covered by Medicare right now. I'm covered by Medicare Part C, or so-called Medicare Advantage Plan. And I have my Medicare card right here that says Parts A and B. So don't tell me that I don't have Medicare Parts A and B. I'm telling you, you are not covered by Medicare Parts A and B if you are covered by a Medicare Advantage Plan. And all but one of the Medicare Advantage plans in Kern County are HMOs. So in other words, if you have a Medicare HMO, even though you have a Medicare card that says Parts A and B on it, you are not covered by Medicare Parts A and B. That is why, whether you go to the doctor or hospital or urgent care, when you have a Medicare Advantage plan, you never show your Medicare card. Or you may show your Medicare card, but they ignore it. They're not going to use it at all. They only want to see, when you go to the doctor with a Medicare HMO or urgent care, wherever you're going, they only want to see your insurance card that you have your Medicare Advantage plan through. Okay, let's continue on here. We're still talking about Part C. So when you have Part C, you never use your Medicare card when you go to the doctor or any other provider, but you only use your Medicare Advantage, that is Part C. Now your Medicare Advantage card, whether it's through Kaiser, Blue Cross, Blue Shield, United Healthcare, HealthNet, Aetna, whoever it is, you only show the ID card from your insurance company, whether you go to the doctor, pharmacy, or hospital. So what happens is, when you elect, whoops, sorry about that. So when you elect a Medicare Advantage plan, you are temporarily forfeiting Medicare Parts A and B. Now, we're going to talk about later how there is a point in time which you can rejoin, so to speak, or get back. If you used to have Medicare Parts A and B and you relinquish it because of becoming covered on a Medicare Advantage plan, you can get Medicare Parts A and B back during 2 times of the year. We're going to talk more about that in just a little while. Now, even though what I told you just a moment ago is true, and that is if you're covered by a Medicare Advantage plan, you're not covered by Medicare Parts A and B, and you say, well, why am I paying the premium for Medicare Part B? Why is it coming out of my Social Security retirement benefit? Or why am I getting a bill every 3 months for my Medicare Part B? The reason is that the federal government wants to still get money from you, and that money that you are paying the federal government is actually being channeled to the insurance company through which you have your Medicare Advantage plan. Not only is your Medicare Part B premium being channeled to the insurance company through which you're getting your Medicare Advantage plan, but a whole bunch more money, you know, like around $700, $800, $900 a month, somewhere around there is going from the federal government to the insurance company that you have your plan with. That's how these insurance companies that sell the Medicare Advantage plans make their money. Let's go to the next slide. So there are 2 times during the year that you are allowed to drop your Medicare Advantage, that is Part C. Remember, Part C and Medicare Advantage are synonymous terms. And these 2 times during the year, you can activate or reactivate. I should not have put just reactivate, but you can activate or reactivate Medicare Parts A and B. The first time of the year is right around the corner, the one we've been talking about, the Medicare Open Enrollment Period. So that is between October 15th and December 7th. And the second time of the year is since January 2019, the so-called Medicare Advantage Disenrollment Period, which used to be between January 1st and, I know you can't see it there, February 14th, Valentine's Day. Now, as of last year, is now January 1st through March 31st is a time, that 3-month period of time, which you can drop your Medicare Advantage plan and return or get for the first time Medicare Parts A and B, and get a standalone Medicare drug plan if you want to. In fact, let's just look down here below because I'm getting ahead of myself. So from January 1st through March 31st, there will be a continuous enrollment and disenrollment period related only to Medicare Part C, Medicare Advantage. So what are the things you can do? You can either drop your current Medicare Part C, Medicare Advantage plan to get another Medicare Advantage plan, or you can drop your Medicare Part C plan and return to Medicare Parts A and B. Third thing you can do, you can drop your Part C plan and return to Medicare Parts A and B and get a drug plan. The fourth thing you can do, drop your Part C plan, return to Medicare Parts A and B, get a drug plan, and apply for a Medicare supplement. But what you cannot do during this time period between January 1st through March 31st, a thing that you can do during October 15th through December 7th, but during this 3-month period between January 1st through March 31st, you cannot replace your current drug plan, your standalone Part D drug plan, with another Medicare Part D drug plan. Okay, let's go to the next slide. So this is kind of cool. Part C, Medicare Advantage plans, are composed and marketed not by the federal government, not by Medicare, but by private insurance companies. There are currently about a dozen Medicare Part C plans offered in Kern County by about 8 insurance companies and other healthcare organizations. So Part C plans must provide coverage that is, and this is very important, on average, at least as good or more, at least as or more comprehensive or good than, or better than Medicare Parts A and B. Now, notice that it doesn't say must provide coverage that is at least or more comprehensive than Medicare Parts A and B, because with a lot of these Medicare Advantage plans, for example, they'll have 0 copays for office visits. Well, when you have Part B, which is for your outpatient stuff like office visits, you don't have 100% coverage for Medicare Part B under Medicare Part B, but you do under some of the Medicare Advantage plans. So how do the Medicare Advantage plans get away with having 0 copays when Medicare Part B requires that you first satisfy this year, 2020, a deductible of $198 and then have to pay 20%? Why don't the Medicare Advantage plans make you have that $198 deductible and pay 20%? Because their Medicare Advantage plans sometimes offer you a better benefit for your office visits, for example, than Medicare Part B offers you. Well, how do they do that? Because they will take away benefits in other areas. For example, ambulance. For example, skilled nursing facilities. Those are just examples. That is not always the case. I'm just citing examples of some of the things I've seen happen with some of these Medicare Advantage plans. So here's the other funny thing about Medicare Part C. It is not only a bona fide part of Medicare, but is also a plan unto itself. And so Part C is both a part and a plan. It is not just a part of Medicare, it is actually a plan unto itself. And the other funny thing is most Medicare Advantage Part C plans throughout the United States, not just in Kern County, include Part D drug coverage. So in other words, with all of the Medicare Advantage plans offered in Kern County, you do not have to purchase a separate drug plan because the drug coverage is already included in your Medicare Advantage plan. All right, now let's move along finally to Medicare Part D. This is cool. So coverage for outpatient prescription drugs, which was included in this act. I'm not going to read the whole thing in the interest of time. So Part D, just like Part C, is not only a part, but also a plan. Guess what? Part D is not only a bona fide part of Medicare, but also Part D is also a plan, a part and a plan. Just like Part C is a part and a plan, Part D is a part and a plan. How do you like them apples? So broadly, you can qualify for Part D if you're enrolled in Part A only, believe it or not, or enrolled in Part B only, or if you're enrolled in Parts A and B. A little note about you veterans out there, or if you know a veteran, if you have VA coverage and you are getting your drugs through the VA, you can postpone getting a Medicare drug plan and never be penalized for it, regardless of how long you wait to, if ever, to get a Medicare drug plan. So drug coverage through the VA is deemed to be creditable. Now, I didn't say credible, like something that can be believed. I said creditable, something that is credited to you so that you will not be penalized. You're credited, so you will not incur a penalty. If you have VA drug coverage, you can wait 10 years down the road and never get a Medicare Part D drug plan, but 10 years down the road, you can get one and you're never gonna pay a penalty for getting your Medicare Part D drug plan late. And it depends on whether or not you should or should not get a Medicare drug plan. If you are currently getting your drugs through the VA, that would be something like somebody like us can advise you on and tell you exactly what you need to do. So let's stop right there and let's ask for some more questions.
Alrighty, Paul, we've had a lot of questions come in, so I will go over the ones that I do have right now.
Okay.
The first one is, if I am covered by my wife's insurance when I apply, do I keep her insurance? And then the next one goes, can I get coverage from Medi-Cal still?
Okay, the answer to the first, let me make sure, I'll repeat the first question, make sure I understood. If I'm covered through my wife's plan, should I get Medicare? Was that the question?
It says, if I'm covered by my wife's insurance when I apply, do I keep her insurance?
Okay, that is a great question also. If I'm covered by my wife's plan, should I keep her insurance? Here's another answer that is not cut and dry, not cut and dry at all. Sometimes it can be most beneficial to stay on your spouse's plan, whether it's a husband or wife, and not get Medicare, or maybe just get Medicare Part A, or maybe even get Medicare Parts A and B and stay on your spouse's plan. The answer, it depends. That is why, and again, this is an educational seminar. This is not a sales presentation, but the way we handle this is when you call us, we have a one-page questionnaire that tells us just about, in fact, most of the time, 100% of everything we need to know about you. And we will very, very easily be able to tell you, after asking you these questions, whether or not you should stay on your spouse's plan and not get Medicare, or stay in your spouse's plan and only get one or two parts of Medicare, or leave your spouse's plan. Why would we ever recommend that you leave your spouse's plan? Only if it will be in your best interest financially, because you might be able to save a ton of money by leaving your spouse's plan, but you might not be able to save anything. And sometimes you can save a lot of money by staying on your spouse's plan by avoiding the Medicare Part B premium. Again, I don't want to get too much in the weeds because we're here to talk about the Medicare Open Enrollment Period, but that was a great question. And then the other question was, if I remember, can I maintain my Medi-Cal coverage, which is California's name for Medicaid? Medicaid and Medi-Cal are synonymous terms. It's just that California refers to Medicaid as Medi-Cal. You can indeed keep Medi-Cal and get Medicare and have them both at the same time. That is called dual coverage, or Medi-Medi. That's the nickname for having Medicare, Medi-Cal and Medicaid. Medi-Cal and Medicare at the same time. Medicare is always primary. If you have Medicare and Medi-Cal, Medicare is always primary. Your Medi-Cal is secondary. Any other questions?
Yes, and I hope I'm saying this right, but it says, if you're out of state on vacation, are you still covered by Medicare?
Great question. Now, the operative phrase there is out of state. The answer is an unequivocal yes. You are covered by Medicare because Medicare is a federal program. It's not a state program. Medi-Cal, however, is a state program, but Medicare, you're covered in all 50 states, the same you would be here in California. Now, if the question would have been, hey, what about when I'm outside of the United States? Am I covered by Medicare? Believe it or not, the answer is a resounding no. Under no circumstances are you covered by Medicare when you're outside of the United States. Even if you have an emergency, you are never covered by Medicare when you're outside of the United States. I lied to you intentionally just a little bit because there is one exception. And that is if you're driving to Alaska and you happen to drive through Canada to get to Alaska, if you have an accident or a bad illness and you're closer to a Canadian hospital than you are to a United States hospital, then Medicare is going to cover you. That is the only exception that I am aware of. Now, some of you may be saying, well, wait a second, I've been outside of the United States and I've been covered. Well, if you were covered, it was not by Medicare, but it was rather by your Medicare supplement or your Medicare Advantage Plan. Normally cover some, not all of your Medicare supplements will cover up to $50,000 over your lifetime. And most of your Medicare Advantage plans are the same way, although you are subject to copays and deductibles if that happens. Okay, any other questions?
Yes. Okay. It says, in 2018, I retired from the county, our Kern County. In December 2020, I'm turning 65 years old. When I called Medicare, they said I automatically have Part A and Part B. Is this correct? And they also said that they're sorry that they tuned in a little bit late, but that they retired in January of 2018.
Would you repeat the last sentence again? If you said something about a little bit late, I did not quite understand.
Sorry, they just said that they came into the meeting just a little bit late.
Oh, gotcha. Okay, perfect. Okay, so if I understand the question, the individual retired from the county of Kern in 2018, and she called Medicare, and they said that you're automatically going to be enrolled in Medicare. Did I understand the question correctly?
Correct, because they said they turned 65 in December of 2020.
Okay, so great question. The answer is it depends. And here's what it depends on. If this individual is already receiving his or her Social Security retirement benefits before age 65, indeed, yes, that person will automatically be enrolled in Medicare Parts A and B. That goes for anybody who is getting ready to turn 65 that started getting his or her Social Security retirement benefits anytime before age 65. You can get them as early as age 62, your retirement benefits. So if you've got your Social Security retirement benefits at age 62, 63, or 64, you will automatically be enrolled in Medicare Parts A and B. You do not need to take any steps in enrolling in Medicare online or in the office, which you can't do right now anyway, if you are already getting your Social Security retirement benefits before age 65. Conversely, if you are not taking your Social Security benefits before age 65, then you will need to enroll in Medicare Parts A and B, or Part A only. It depends on your situation. You'll need to do that online. You cannot walk into the Social Security office to do so. You must do it online, and somebody like us can help you do that. It's a very easy thing, but there are a couple little funny things that you have to know about. I don't want to go into that right now. Not the least of which is you have to establish a username and password, and they ask you questions about, where did you live on this street, in 1995 or whatever. They ask you a bunch of sometimes hard to answer questions, but just suffice it to say that if you are not taking your Social Security benefits before age 65, you must enroll in Medicare online. Okay, were there any more questions?
Yes, I'm going to go ahead and do one more for this this portion. That question is, when do penalties apply to non-vets?
When do penalties apply for what?
To non-vets, non-veterans.
Oh, to a non-veteran. Penalties apply to well, the same penalty, it doesn't matter whether you're a veteran. Okay, now I take that back. I just got through telling you a few minutes ago that for Part D for drugs, for a person that has VA insurance does not have to get Medicare Part D for drugs. We're just starting to talk about that right now. But rather, when and if that person who did not elect to get Medicare Part D for drugs because of having VA insurance and getting the drugs through the VA, that person will never have a penalty if that person ever wants to enroll in a Medicare drug plan down the line. But if you do not have VA insurance or any other type of creditable coverage, like through a group plan, you are exposed to Part B penalties and Part D for drugs penalties. B as in boy and D for drugs, depending on your situation. That is what we take pride in doing, is when we assess your situation, we're going to make sure that you're not going to be exposed to those penalties. Again, not only us, there are other people here in this area that also understand this as well. But we are here to answer any questions in that regard. Any other questions at all? Are we going to move along now?
We will move along now.
Okay, let's move along. Okay, the three most popular ways to get Medicare coverage. Way number one is to be covered by Medicare Parts A and B alone. Believe it or not, there are about 20% of all people who have Medicare only in the nation only have Medicare Parts A and B. Now, I think that is not a wise thing to do, but that is the truth. There are about 20% of all people are only enrolled in Medicare Parts A and B with no supplement and no Medicare Advantage Plan. But listen to this. If you only have Medicare Parts A and B alone with no Medicare supplement, your exposure is up to a little over $900,000 a year. Now, if you have Medicare Part A and B alone, you can add a prescription drug to Part A and B, remember, like we talked about earlier. So the reasons you might want to think about, most popular way number one is for these three little bullet points. It is the least expensive of all three options. Why? Because the only out-of-pocket cost you have is for your Medicare Part B as in boy. Also, your only, well, that's what I just mentioned. Actually, the second bullet point is what I just said. Your only exposure is Part B unless you get a Medicare drug plan added to Part A and B. Then you would have a premium for your drug plan. And that can be as low this year as $13.20 a month. The last reason you might want to elect this option is the 2020 standard Medicare Part B premium. Actually, I already just mentioned this, is $144.60 a month. Maybe I didn't mention that. That is the so-called standard premium that applies to about 95% of all people who have Part B in the United States. Their premium is $144.60, but it can be as high as $490+ a month if you are a higher income earner. That is another thing we make you aware of. When people contact us, we let them know so they won't be blindsided. Whoops, they won't be blindsided as to what their Medicare Part B premium is going to be, even though that doesn't have to do with any type of insurance product that we offer. We want to educate you to the fullest extent possible about Medicare, not only about the plans like Medicare supplements and Medicare Advantage plans and drug plans, but also the other areas of Medicare that we do not profit by. Let's just say it like that. Okay, let's go to the next slide. Okay, the second most popular way to get your Medicare coverage is to be covered by Medicare Parts A and B, like we just mentioned, along with a Medicare supplement, also known as a Medigap plan. So Medicare supplement and Medigap mean the same thing. And you can also add a Medicare Part D drug plan. So in that instance, that number 2, you would actually have a total of 3 ID cards. ID card number 1 would be your Medicare card. ID card number 2 would be your Medicare supplement or Medigap plan. Plus, your third ID card would be your Medicare Part D drug plan. So the reasons for electing this option, the main reason is freedom to choose any provider in the nation that accepts Medicare, which is about 93% of all non-pediatric doctors take Medicare Part B, and 100% of all hospitals except VA hospitals and a handful of specialty hospitals like your drug addiction hospitals, alcohol addiction hospitals, stuff like that, sometimes don't take any insurance or Medicare. Let's see here. Oh, so 100% of all acute hospitals in the United States, except VA hospitals, and a handful of drug abuse hospitals take Medicare. So you want to go to Cedars-Sinai, UCLA, USC, Stanford, all your hospitals in Bakersfield take Medicare. So that includes both your Mercy hospitals, Memorial, San Joaquin, Heart Hospital, KMC. All of them take Medicare. So you have complete freedom of choice, and 93% of all doctors. So you want to go to a heart specialist in New York, or you want to go to a doctor in Texas or Nevada or any place. Remember, Medicare is a federal program, so there is no network with Medicare and your Medicare supplement. There is no in-network and out-of-network providers at all. That's why I refer to them as freedom of choice plans. So the second reason, out of all 32 Medicare Part D drug plans this year, we don't know how many they're going to be next year. It should be about the same. In 2020, you can choose every year the plan that will allow you to spend the least amount out of your pocket. That is so cool because, well, I'm getting ahead of myself. Let me just continue on. So, whoops, the third bullet point, let me go back. I messed up again. So the third reason you might want this number 2 option is to be able to choose a Medicare supplement insurance company that has an A+ superior financial rating from AM Best Company, which has been around since 1899. Currently, only a couple insurance companies offering Medicare supplements in Kern County enjoy an A+ rating from AM Best Company, which is established in 1899. The third reason, or the third thing, pardon me, the third way you can be covered by Medicare is by being covered by a Medicare Part C, Medicare Advantage Plan. So currently, All Medicare Part C plans in Kern County include the drug coverage, as I mentioned earlier. So there's no need for you to get a separate drug plan. You couldn't if you wanted to. Why? Because it is unlawful. You notice I didn't say illegal. Unlawful for you to get Medicare Part C and a separate drug plan. You cannot do that. So you have to take, and I'm not saying this is a negative thing, it's just a fact, you have to take whatever drug coverage your Medicare Advantage plan includes in its Medicare Advantage plan. You do not have an option of electing any of 32 drug plans as you do when you have your own separate drug plan that would accompany your Medicare supplement, which is what we just talked about in the slide before this. So the reasons for electing a Medicare Advantage plan would be zero premium or a very low monthly premium. Most of the Medicare Advantage plans offered in Kern County have a zero premium. Also, you have, quote, free, unquote. I say free, really? Who's paying for it? Free ancillary benefits like your gym memberships, hearing aid discounts, preventive dental benefits. Somebody is paying for those. You need to ask yourself that question and see if you can get the answer. No additional premium for a drug plan, because it's included in your plan. No copays or low copays for commonly used services, like I mentioned earlier, office visits and urgent care. That is not always the case, but it is true a lot of times when you're covered by a Medicare Advantage plan. So any questions so far on the last couple slides?
Yes, so we're filtering through the questions, and let me just go ahead and start with this one first, Paul. It says, if I choose Part C, will Medicare pay that portion with my monthly deductions?
Will Medicare pay that portion with my monthly deduction? Was that the question?
Yes.
Okay, well, Medicare, okay, I think I understand what the questioner is asking, but that can be understood in one of two ways. So if you have a Medicare Advantage plan like we just went over, that is like a Medicare HMO here in Kern County, then you are required to pay the Medicare Part B premium, which for most people is $144.60 a month, which is normally coming out of your Medicare, your Social Security retirement benefit. So you are paying for that. Now, this only pertains to you if you have a Medicare HMO plan. Not only are you paying that Medicare Part B premium to the federal government, but then the federal government turns around and channels that Medicare Part B premium that you just paid the federal government. Now the federal government turns around and channels that to the insurance company that you have your Medicare Advantage and probably HMO coverage with. And by the way, all those companies whose names I just mentioned earlier, Anthem Blue Cross, Blue Shield, United Healthcare, Health Net, Aetna, Kaiser, and I left out a couple that are not quite as well known, but those insurance companies are getting that Medicare they are getting that Medicare Part B premium that you just paid the federal government. But not only are they getting that Medicare Part B premium, they are getting more money than just that. Usually it's somewhere around $700 to $900 on top of that Medicare Part B premium to take care of you. And you say, are you kidding? They get that much money per month? Yep, they do. And then they distribute that money to the doctors and other providers who are participating in the Medicare Advantage plans. And those other providers get what is called a capitation fee. Capitation comes from the word Greek, the Latin or Greek, come on, brain. I believe it is a Latin word, caput, which means head. I think it is a Latin word, meaning head. So the doctors get paid per head for each patient they have every month, whether the doctor sees you or not. How do you like that? Okay, any other questions?
Yes. I have another one. It says, if I continue to work past 65 and have insurance, will I be penalized when I sign up later for Medicare?
The short answer is probably not, but it can depend on some various things. Now, if you are, I don't want to get too much in the weeds, but if you're employed by an employer that has 20 or more employees, you can work till age 127 and never ever have to get Medicare Part B as in boy. Believe it or not, and you'll never be penalized. The key is how long are you going to be actively employed? The key is your active employment determines whether or not you will be penalized. So as long as you are actively employed, you will be granted a special enrollment period. This is a different type of Medicare enrollment period, a special enrollment period, SEP, as long as you continue to be actively employed by a group plan by your employer, okay? So again, for somebody who's in that situation, let's say you're going to work till age 68, okay? You can stay on your employer's group plan and never be penalized if at age 65, now you want to get Medicare, if you didn't have Medicare at all, Parts A and B, or you want to get, if you already have Part A, let's say you got Part A at age 65, but are continuing to work to age 68, you don't have to get Medicare Part B, and you will not be penalized, but you want to make sure that you have Part B as of your date of retirement, or the first of the month closest to your date of retirement. Now, just because you're not going to be penalized does not mean that you should not get Medicare Part B. Sometimes, even though you continue to be actively employed, it can be in your best interest to get Part B. Again, I know this is posing a lot of different scenarios. That's why I can't recommend highly enough for you to see somebody, get a second opinion to make sure that you have the ducks that you think you have in a row, actually in a row. Okay, any other questions?
Yes, we had a couple as far as income. The first one is, does your Part B premium, if it is high due to high income, reduce if your future income reduces?
That is a terrific question. The answer is it's supposed to, but I've seen situations when it hasn't happened. Now, am I going to fault Social Security Administration for not keeping an eye on that? Be it far from me, because what do I know? Somebody from Social Security might be listening right now. So I want to be very careful with this. If you are a higher income earner, what is a higher income earner? Well, if you're a single tax filer, that means anybody who, after you take deductions, and actually the term is modified adjusted gross income. If your modified adjusted gross income as a single person is greater than $87,000 a year, then you are a high income earner in the eyes of Social Security. If you are a couple and your modified adjusted gross income is twice that amount, so $87,000 times 2 is $174,000. This is after deductions, have a joint income of more than $174,000, you are a higher income earner. So if you retire and your income goes down, or let's say you retire and you're given a severance package, which causes your income to spike, you might have to pay 2 or 3 times higher premium for your Medicare Part B just for 1 year. But then it should reduce, but I tell people to keep an eye on that, to make sure that Social Security is keeping an eye on it, and that they reduce your Medicare Part B premium based on your income being reduced. You need to keep an eye on that. That is another thing we'll show you how to do. We actually have a grid that shows you all of the Medicare Part B premiums. And by the way, do you know what president signed that into law? 2006. Who was president in 2006? It wasn't former President Obama. It was George W. Bush that did that. He started spreading the wealth himself in 2006 and makes higher income earners pay almost 3 times the amount as somebody who is not a higher income earner. Some people think that's fair. Some people don't like that at all. That's a philosophical debate. Okay, was that as clear as mud?
I sure hope so. So we're going to go ahead and answer one more for this segment.
Okay.
Sorry, I cannot speak right now. Which website do I go to apply for Medicare?
Great question. Medicare.gov or socialsecurity.gov. So I say so in other words, if you're not taking your Social Security retirement benefits before age 65, because remember, if you do that, you don't have to enroll in Medicare. You will automatically get your Medicare card with A and B on it in the mail. And you say, well, what if I get that card and I don't want Medicare Parts A and B? Well, there is a way to notify Medicare that you do not want, say, Part B at this time. You can do that. I don't want to get into the weeds of telling you how to do that right now, but it can be done. But for those of you who are not getting your Social Security benefits before age 65, you need to enroll online. So just go here. I know this by memory. I can tell you this. You go to Medicare.gov. If you want to write this down, because it's not in our presentation, go to Medicare.gov. In the upper left-hand corner, there's a dark blue icon, rectangular icon that says sign up / change plans. Sign up / change plans. You just scroll over that. You don't click it. You just scroll over that icon, sign up / change plans, and you're going to have a drop-down box. The fourth little line down says enroll in Medicare online, and you just click that. And you just follow the instructions. Now, you're going to get to a point where it's going to have you establish a username and password. You follow the instructions. And again, I don't want to go through the whole thing on this, but that's how to get started. You go to Medicare.gov and scroll over upper left-hand corner, the dark blue, kind of a real dark sky blue icon or link, pardon me, that says, or maybe it's like whatever, a link. Scroll over and you'll have a drop-down box. The fourth line down in that box says enroll in Medicare online. You click it and you go for it. Okay, any other questions?
Nope, you can continue on and then we'll go through the questions on the next break.
Okay, perfect. Let's rock and roll. All right, so let's see. So if you have Medicare Part C, also known as, well, let's start over here with the guy with A, this handsome gentleman. If you have Part A only, you can add a drug plan to Part A if you want to. If you have Part B only, you can change your Part D drug plan, and you can add Part D drug plan if you currently do not have one. Now, very, very few people, probably less than 0.01% of all people have Part B only. Usually it has to do with foreigners that come to the country that do not have enough credits to qualify for Part A. So that isn't very many people. So Part C, if you have Medicare Part C, also known as Medicare Advantage, most of those plans are Medicare HMOs here in Kern County. And if that plan includes drug coverage, you can change to a new Medicare Advantage plan that includes drug coverage, or the second thing you can do, you can drop your Medicare Advantage plan and automatically return to Medicare Parts A and B. Sorry, that's covered up there. The third thing, you can drop your Medicare Advantage plan and automatically return to Medicare Parts A and B. Again, it's covered up, sorry about that, and add a Part D drug plan. Fourth thing you can do, drop your Medicare Advantage plan and automatically return to Medicare Parts A and B and add a Medicare Part D drug plan and apply for a Medicare supplement, also known as Medi-Cal. By the way, you might be asking yourself, how do I drop my Medicare Part C, Medicare Advantage, probably an HMO, Medicare HMO plan? The easiest way to do it during this upcoming time of the year, October 15th through December 7th, as well as during January 1st through March 31st, this is going to sound funny, but it's true. The easiest way to drop your Medicare Advantage plan is to simply enroll in a Medicare drug plan. You say, how in the world would that happen? Because federal law says that it is unlawful. You notice I did not say illegal again. It is unlawful to have two drug coverages simultaneously. Well, if you have a Medicare Advantage plan, and here in Kern County, you also have drug coverage included in that. Well, if you want to leave your Medicare Advantage plan that includes drug coverage, all you need to do is enroll in a standalone Medicare drug plan. And when the insurance company that you're applying to for that standalone drug plan gets your application, they're going to approve you, and they're going to notify, that insurance company is going to notify Medicare that Joe Blow now has a standalone drug plan. And Medicare is going to say, wait a second, Joe Blow already has drug coverage in his Medicare Advantage plan. So guess what happens? The new kid on the block, that is your brand new drug plan, kicks the old kid on the block, that is your Medicare Advantage plan, that is tied to your drug plan, kicks it out of the picture. And what happens is you automatically return to Medicare Parts A and B and get a Medicare drug plan. And then you are free to also apply for a Medicare supplement. That sounds kind of weird, but it is true. So the long and short of it, the easiest way to disenroll or drop a Medicare Advantage plan is simply to enroll in a drug plan. And that is something that somebody like us can help you with. All right, let's look at the next slide. So if you have Medicare Parts A and B, you can add a Part D drug plan. You can apply for a Medicare supplement. You can add a drug plan and apply for a Medicare supplement. And you can replace your coverage under Medicare Parts A and B with a Medicare Advantage plan. That's kind of the opposite of what we were just talking about. And so if you want to go to a Medicare HMO and leave Medicare Parts A and B, you can do that between October 15th and December 7th. You cannot do that. You cannot do that between January 1st through March 31st. And here we have, if you have Medicare Parts A, B, and D, and a Medicare supplement, sorry again that's covered up, you can change your Part D plan for a different one, change drug plans, very popular thing to do. You can add Medicare Part D and Medicare Part D drug plan if you currently don't have one. You can drop your current Medicare Part D plan, drug plan. That would be a very foolish thing to do. Or you can apply for a Medicare Advantage plan, or you can replace your Medicare Advantage plan. Let's see, what does that say? I cannot remember. Replace your Medicare Part C plan with Medicare Parts A and B and your Medicare, and you get your Medicare drug plan, get a Medicare drug plan. Sorry that that's covered up there. I apologize for that. Let's go to the next slide. Okay, the other actions you can take during the upcoming 2021 AEP, also known as the Medicare Open Enrollment Period, between October 15th and December 7th. If you have Medicare Parts A and B and a Medicare supplement and a drug plan, you can do all these 5 things. You can change your drug plan only, very popular. You can add a Part D drug plan if you currently don't have one. Number 3, you can drop your current Medicare Part D drug plan and be left without any drug coverage, a very foolish thing to do. You can also drop your Medicare supplement, and you can replace Medicare Parts A and B and your Medicare Part D drug plan and your Medicare supplement with a Medicare Advantage plans that includes drug coverage. Now, here's something that's very important to consider. If you remain on a Medicare Advantage plan for longer than 1 year, so let's say you get a Medicare Advantage plan for the very first time in your life. If you remain on it for longer than 1 year, that can mean 1 year plus 1 day or longer, you will never be guaranteed for the rest of your life, guaranteed for the rest of your life to get a Medicare supplement unless you qualify for a particular special enrollment period, such as when, number 1, your Medicare Advantage plan ceases to exist or leaves your geographical area. Number 2, you move to an area in which your Medicare Advantage plan is not offered. Okay, so now let's take a look at the reasons for which you might want to consider one format, two of the most popular formats. That is, first format to have Medicare Part A, Part B, and Part D, plus a Medicare supplement versus, so here's the first alternative, Medicare Parts A, B, and D, and a Medigap, that is a Medicare supplement, versus the second most popular alternative is to get Medicare Part C or Medicare Part C and D. Because remember, if you have Medicare Part C, Medicare Advantage plan in Kern County, you also have Part D included in it. So we're going to call this guy right here C and D. So let's see what happens. Here are the comparisons. So if you're on this side of the aisle with this area of coverage, compared to this side of the aisle with this, with the way this covers your different areas of coverage, let's take a look. So with the Medicare Part A and B and supplement and standalone drug plan side, you have the advantages. You have the freedom to choose any provider that accepts Medicare, which is about 93% of all doctors take Medicare Part B, and all hospitals take Part A except for VA and certain specialty hospitals. If you're on a Medicare Advantage plan, you do not have that same freedom of choice because you must choose one primary care doctor to manage all of your care. You cannot see a specialist unless you get a referral from your health plan. Now, sometimes there's one particular Medicare Advantage plan, I don't want to name the name, that says that if you go to a specialist, as long as the specialist is listed within the network of the Medicare Advantage plan that you have, then they will let you, sometimes by paying a higher copay, go to that specialist without being referred. But otherwise, you always need to get referred to a specialist. You cannot see a specialist on your own. So on this side of the aisle, you have no network of doctors and hospitals. You can go to any doctor or hospital without being restricted to going to in-network and out-of-network because there is no network with Medicare and your Medicare supplement. On this side of the aisle, you have a limited network of doctors and hospitals. On this side of the aisle, you have the freedom to access any Medicare provider in all 50 states. Over here, generally, you must access all of your doctors and hospitals within the county in which you live, except for, that's what it says underneath this, for urgencies and emergencies. On this side of the aisle, there are only 11 standardized Medicare supplements nationwide. However, there are only 8 standardized Medicare supplement plans for those who get Medicare on or after January 1st of 2020. On the Medicare Advantage side of the aisle, there are currently 19 Medicare Advantage plans in Kern County for this year. Okay, moving along. This side of the aisle, with any particular Medicare supplement, coverage is identical between insurers. That is to say, there are only 11 standardized Medicare supplements in the United States. So in other words, whichever one of those Medicare supplements you pick, let's say Plan G, for example, the coverage is exactly the same with Plan G, regardless of the insurance company you get it from and regardless of the state that you live in. On this side of the aisle with Medicare Advantage, coverages vary greatly between insurers. In other words, there is no standardization other than having to provide benefits that are on average at least as good as Medicare Parts A and B provides. Okay, next, this side of the aisle, with 3 out of the 11 standardized Medicare supplement plans that I recommend, the annual out-of-pocket maximums are either $0 per year, $198 per calendar year, or $2,340 per year. Medicare Advantage plans have an average of $4,053. Now, how did I get that? What I did in all 19 plans, I added up the ranges of the out-of-pocket maximums, which range from $999 to $6,700. And then I divided by the number of plans, the 19 plans, and we get $4,053. Okay, next, on the Medicare supplement side of the aisle, you have complete portability and continuity of coverage when you travel or move to any other county or state. Your coverage will remain the same. On the Medicare Advantage side of the aisle, there is rarely portability or continuity when you travel or move to another county, or you must normally change your plan and pick a new primary care doctor when you move. So you do not have that portability aspect with the Medicare Advantage plans that you have with original Medicare and a Medicare supplement. Okay, and I think this is the last one or next to last one. So on this side of the aisle, then we're going to take questions for the remainder of the workshop. With California's birthday rule, a unique law to California, and there's another similar law in Oregon, you can change your Medicare supplement each year within, actually it's 60 days. I forgot to change that. This is a brand new change to this law. It used to be 30 days. Now it's 60 days before or after your birthday to a plan of equal or lesser value. You can apply to change your plan between October 15th and December 7th with a new plan effective date of January 1st. On this side of the aisle, unless you are subject to any number of these special enrollment periods like moving out of the area, or if your plan's discontinued, or if you have an emergency, you must change your plan during the Medicare Open Enrollment Period between October 15th and December 7th. Okay, on this side of the aisle, all Medicare supplements and standalone drug plans charge a monthly premium. That is a so-called negative thing about having a Medicare supplement, because with the vast majority of Medicare Advantage plans for 2019 and 2020, most Medicare Advantage plans have a zero premium. There are a couple that are around $20 to $30 a month, and there's one that is $73 or right around there per month. So Medicare Advantage plans definitely have the advantage with regard to having lower premiums, but not the lower annual out-of-pocket maximums as we just saw, and not with respect to freedom of choice, which is inherent with Medicare Parts A and B and supplements. It is not something that is inherent with Medicare Advantage plans. And over here, another negative about Medicare supplement plans, for the most part, offer no ancillary benefits. There are a couple exceptions. That is, no free, so-called free gym memberships, hearing aid discounts, and preventive dental benefits. However, with Medicare Advantage plans, they do offer ancillary benefits, such as the so-called free gym memberships, hearing aid discounts, and preventive dental benefits. Now, this is the last slide. And so compensation is something you need to be aware of with insurance agents. We all make money whenever we sell a plan. So with Medicare supplements, an agent receives on average compensation of about $30 a month for the sale of a Medicare supplement, so about $360 a year. The agent normally continues to get this monthly amount over the next 6 to 10 years, sometimes longer, with most insurance companies. In California, an agent can receive annual lump sums of up to $630 for Medicare as a commission or fee for a Medicare Advantage plan, and usually continues to receive annual compensation of around $315. That is for this year. This compensation can increase each year, and the federal government is the one that determines how much that can increase. As far as filling out an application, it takes about twice as long to fill out an application for a person enrolling in a Medicare supplement and a separate standalone drug plan as it does for an insurance agent to complete a Medicare Advantage plan. Okay, so now we have about 20 minutes, 20 minutes left for questions that any of you have before we finish our workshop. Do we have any takers?
Yes, Paul. We do have quite a bit of questions, so I do want to let everybody know, if you guys still stay to the end of the presentation, there will be a survey where if your questions were not answered today, please go ahead and ask them there, and then we definitely will be able to get back to you on that. Okay, so the first question is, how can I find out what my mother has or what she is covered under? And it does say that she's age 75.
Okay, great question. The easiest way is to, if you can scan an email or fax us, or even just call us with her ID card that represents the coverage she has, we will be able to know if she has a Medicare supplement or a Medicare Advantage plan, or maybe your mother is only covered by Medicare Parts A and B with no Medicare supplement or no Medicare Advantage plan. So in other words, if you can only find her Medicare card, you might want to ask your mother, as long as she's able to speak, say, hey, Mom, do you have any other coverage, or do you have to show any other card when you go to the doctor or to the pharmacy? And if your mom doesn't know, let's say she has a little dementia maybe, you might want to consider going with her to the pharmacy or to the doctor. And if she's there to give you permission to speak on her behalf, then you could find out by asking her doctor as well as the pharmacy as well.
Thank you. The next question is, if we're here now, I'm guessing in California, but we'll retire in Shasta County, can we get the plan here or the Advantage plan here, or do we need to get it there?
Did you say Advantage plan?
It said Advantage plan.
Advantage plan. Okay, Medicare Advantage plans are local. They can be local plans. There can be variations from county to county. So it depends on what plan, if you start here in Kern County, as to whether or not that plan is available in Shasta. I think that's where they said, Shasta County.
Yeah.
So if that plan is if they offer that same exact plan, then you can keep it. If they do not offer that same exact plan, you have what is called a special enrollment period, for which you'll be granted, and you can do anything you want. You can get another Medicare Advantage plan. You can actually return to Medicare Parts A and B and get a Medicare supplement plan. That is one of the exceptions that I mentioned earlier to being on a Medicare Advantage plan and then being able to get a Medicare supplement plan. Okay.
Thank you on that one. The next question is, do Advantage plan rates also go up by income?
Okay, the answer is no. Medicare Advantage and Medicare Supplement plan rates have nothing to do with your income. The only two things that have to do with your income, thing number one is Medicare Part B as in boy. And I failed to tell you a little earlier, you viewers and listeners, that I told you that George W. Bush in 2006 imposed that a higher premium for higher income earners, but then former President Obama came along in 2011 and signed a law that took place January of 2012 that requires higher income earners under the same higher income parameters to pay a higher premium for their drug plan. So in other words, let's take the least expensive drug plan in California right now, $13.20 a month. So if you are a higher income earner, you could pay as much as a little over $70 a month on top of that $13.20 a month as a surcharge. Now, the federal government likes these silly names that make things sound innocuous when they can be very harmful. One of those innocuous terms, acronyms, is called IRMA, I-R-M-A-A, IRMA with an extra A. Income Related Monthly Adjustment Amount, which is a fancy way of saying we're going to screw you if you make too much money. Now, maybe I shouldn't have used the verb screw. We're going to penalize you, so to speak, or surcharge you if you make too much money. So you can have a couple that, based on their income, can end up paying over $1,000 a month just for their Medicare Part B and their Medicare Part D surcharge, thanks to George W. Bush and former President Obama. I guess George W. Bush is also a former president. I shouldn't pick on just Mr. Obama. Okay, so in other words, your Medicare Part B premium, or your Medicare Advantage premiums and your Medicare Supplement premiums have nothing to do with your income. It's Medicare Part B, not a plan, Part B and Part D have to do with your income. Okay, next question.
Yes, next question is, as a teacher, I do not qualify for Social Security. How does this affect my Medicare cost, if any?
Great question. It does not affect your Medicare costs, your Medicare Part B costs per se, but here's the cool thing. If you're a teacher You have STRS, State Teachers Employee Retirement Systems. You can, if you don't have enough money to qualify for Social Security to allow for your Medicare Part B premium to come out of your Social Security benefit, you can have your Medicare Part B premium come out of your STRS retirement benefit. And about a month and a half to 2 months before qualifying for Medicare, STRS normally sends you about a 3 or 4 page letter. And the main purpose of it is for people like you who asked that question to sign off and allow STRS to deduct your Medicare Part B premium from your STRS retirement benefit, because STRS and Social Security have an arrangement by which Social Security allows STRS to deduct your Medicare Part B premium. How cool is that? So if you're not a teacher, let's say you're a custodian or bus driver or work in the office and not a teacher, then you probably have PERS. PERS, is my understanding, I may be wrong on this, but I think I'm correct, will allow you to do the same thing that I just mentioned about STRS. You'll want to check with PERS to make sure they will let you also deduct your Medicare Part B premium from your PERS retirement benefit, just like STRS allows you to do so. Okay, we've got about 10 minutes left.
Okay, let me go ahead, and the next one is, it's a little lengthy, so I'll try and slow down for you. It says, I turned 65 in July 2020, planning to work 1 more year, so that at the time I only signed up for Part A because my employer paid for all of my medical insurance premiums. Well, I got laid off at the end of August. Do I need to sign up for Part B now, or do I wait until the open enrollment period in October to sign up for Part B and D?
Okay, the open enrollment period has nothing to do with your situation. The person that asked that question has nothing to do with your situation. Now, that can be a very difficult question to answer without asking a whole bunch of more questions. So I would suggest you can call us or you can call somebody else, but we can size up your situation. So let me use an example. You said the person said she got laid off how long ago?
In August.
In August, okay. And only has Part A. So if that person is not going to be returning to work at all, then that person needs to get Part B immediately. And we can show you how to do that. And then, but if you, for example, let's say you might be rehired, we need to know that, because if you're going to be rehired within a quick period of time, you may not need to get Medicare Part B. Or if you're going to be rehired by another employer, it depends on the size of that employer as to whether or not you need to get Part B. There can be some very detrimental effects by not getting Part B in your situation, the person that asked this question. But I would recommend that you just give us a call and we can size your situation up within 5 minutes, maybe even less, and let you know what you need to do.
Perfect. Thank you for that answer. The next question is, I'm retired from the city of Bakersfield with my retiree medical insurance from the city. However, I am not eligible for Medicare. My wife will be eligible, but she is 4 years younger. Will I be penalized for not signing up for Medicare?
Fascinating question. Okay, now I would love to know the ages of those two people, because here's the rule. The person, I think it's a retiree from the city of Bakersfield or still employed, did they say? Hello? Anybody there?
Yes, yes.
Okay, did that person say they're still employed with the city of Bakersfield or retired?
Let me take a look. It just said that they were retired. Retired,
okay. And so they don't have enough credits to qualify for Medicare. So now the city of Bakersfield, I may be wrong, but I believe they will let you stay on their retiree plan. I shouldn't even say this. You need to check to see if they will allow you to stay on their plan, and to see if I believe that's a Blue Shield plan, if I'm not mistaken, to see if they will allow you to stay on your Blue Shield plan without having Medicare Parts A and B, and to find out from the benefits department of the city of Bakersfield to see if that Blue Shield plan will still continue to provide you with the same benefits, even though you do not have coverage under Medicare Parts A and B. Okay, now here's the second part of that question. That person said that his or her spouse does have enough credits to qualify for Medicare, but is 4 years younger. So federal law says that if you do not have enough credits to qualify for Medicare, but as long as your spouse is at least age 62, then you, even though your spouse at age 62 is not taking his or her Social Security retirement benefits, as long as your spouse at least age 62 is eligible to take his or her retirement benefits, then the older spouse is eligible to qualify for Medicare Parts A and B through that younger spouse. Isn't that cool? But with the information that I was given, I don't know how old those people are, so I can't give an unequivocal answer to that question.
Alrighty, thank you, Paul. So what we're going to go ahead and do, Paul, is we're going to go ahead and wrap it up with the questions for now, or for today, I'm sorry. And then I know you do have a couple of closing things that you would like to say.
Absolutely. So I want to thank, first of all of you who participated in this or who are viewing this workshop. We are very blessed that you took time out of your very busy days to do so. And also I want to thank the personnel who helped us with this workshop, the personnel of Valley Strong Credit Union. And I cannot believe, now correct me if I'm wrong, but I don't think, Selena, that I've mentioned Kern Schools Federal Credit Union this whole workshop until just now. Am I correct?
You did great.
Okay, thank you so much. Even if you're not telling the truth, I'll still accept that. So I do want to thank Jaime Doñas and Selena Perez, who is the young lady who's talking right now, Irvin Garduño, Mallory Cuevas, Renee Killian, Adam Vinson, who does the graphics, and also two people who are not directly participating in putting together this workshop, but who are instrumental in allowing us to get involved with these workshops, and that's Mike George and Patty Reed, no relation to Donna, by the way. And so thank all of you people for putting together this fantastic workshop and for allowing us the opportunity to be of service to everybody. One last thing, let me mention that we charge no fees for consultations and recommendations and all that stuff. You say, well, how do you make your money? If and when we sell you a plan, we make money. If we don't sell you a plan, we don't make money. You say, well, that's not very, believe me, we're very blessed. So we want to encourage you, don't feel hindered and think that we're going to charge you fees for getting together with you or have you calling us and asking us questions. We do not. Actually, I said getting together. That was actually a lie, because right now we're only doing phone consultations because of the virus situation. But hopefully sooner rather than later, we will be seeing our prospective clients face to face. So with that, thanks again, and we appreciate the time you've taken to hear us out.
Perfect. Thank you, Paul, for stating the fees. I know a lot of people did ask some questions about that, so thank you for doing that. And he did have his information up for you guys. We just want to thank you guys for joining us this evening, and we hope that you did enjoy this content and that you leave feeling prepared for open enrollment for Medicare. After the end of this meeting, you'll be presented with a link to take a short survey regarding today's webinar. This is where you can ask all the additional questions, and if you feel like your question was not answered in this presentation, just please be sure to include your contact information so that someone can reach out to you in order to answer those. And of course, on behalf of Paul Sheldon and Valley Strong Credit Union, we want to thank you guys for joining us and have a wonderful night.